Okay, great. So, hi, everybody. Thanks for having me here. I'm happy to be speaking to you today. I know Heather through her clinic, Good Health Physical Therapy and Wellness. I've been working as an occupational therapist there since earlier this year. And I'll tell you first just a little bit more about me. So, I got my Master's of Science in Occupational Therapy from San Jose State University in California. I also got my Bachelor's of Arts in Spanish and Communications at another California school, UC Davis. My experience has been in acute rehabilitation, mostly working with neurological patients in a hospital setting. And then I also have experience working in inpatient behavioral health, treating patients with severe mental illness. So that just kind of speaks to the variety of things that OTs can do and the wide scope of our practice. And then additionally, I've trained as an outreach movement facilitator with this wonderful nonprofit that brings mindful movement and dance to hospitals, jails, recovery centers, and elderly homes. And from this, I've become very passionate about really working with the mind-body connection and our ability to sit with what's happening in our bodies, as difficult as that can be. I think that there's a lot of power there. So I'm also passionate about providing treatment in functional cognition, habit training, habit creation, pain and fatigue management, sensory integration, ergonomics, and neurological rehabilitation. So that's mainly what I offer at Good Health. And then, like I said, I use a mind-body holistic treatment lens, and I address physical, cognitive, and emotional symptoms to support patients in establishing healthy functional habits and building skills to better manage their conditions. So OT really does take this more broad approach, and we incorporate all different aspects of somebody's life. And then just a little bit about what I enjoy. I really love dancing, hiking, cooking, reading, swimming, and then spending time with my loved ones and any dog I see. I don't have a dog yet, but I'm excited to have one, and I will pet everyone else's in the meantime. So let's move on to the next slide. Okay, so in this discussion, I'll be talking about a number of topics. One being what occupational therapy is. I think a lot of people don't understand because we are in so many settings doing so many things. So we'll cover a little bit about OT. And then second, we'll talk about cognitive challenges like Heather mentioned. Third, we'll go over sensory processing. And if that doesn't make sense to you, that's okay, we'll get there. Fourth, we'll go over the emotional impact of chronic illness. And then we'll talk about some handy tools. We'll discuss work and school accommodations, and then chronic pain and fatigue. And then we have a group activity at the end. All right, so what is occupational therapy? It's a good question. So occupational therapy is a health profession focused on helping individuals regain independence in their daily lives and in their daily activities, which we refer to as occupations. And that doesn't mean just your job occupation. So it includes any meaningful activity that a person wants to accomplish, including like caring for yourself and your family, doing your chores at home, working, going to school, sleeping, even participating in hobbies and other things like that. So because the term occupational or occupations is so broad that we can approach different aspects of your life from a holistic lens. And again, we assess and treat a range of physical, emotional, cognitive, and social challenges to basically improve your overall quality of life. So some key components of OT include functional assessments. So we get an idea of how your injuries or your conditions are impacting your daily tasks. And then we provide personalized treatment plans and create strategies that are really tailored to you and what's meaningful to you. We work with your values, your interests, your environment, the context that you're in, to help you regain or enhance your abilities. And then thirdly, we do a lot of work with adaptive techniques because We're strong believers that if we increase access to the occupations that are meaningful to you, then your whole well-being will improve, because being able to engage in the things that mean something to us, I think, has a really strong impact on our mental and physical health. So in that vein, we teach skills, but we also teach compensatory strategies or use assistive devices or tools to facilitate daily activities. And then finally, as I've mentioned, we take a holistic approach. We address all aspects of someone's life, because all aspects of someone's life affect one's health. All right, so I'm moving on to talking about the cognitive and organizational challenges. So managing one's chronic illness can feel like a full-time job, as I'm sure you are all aware. Being in chronic pain can lead to brain fog and memory issues. There's also a significant correlation between EDS and neurodivergence. So most of my patients have ADHD, if not also autism. Therefore, I end up working a fair amount with addressing cognitive challenges and supporting organizational strategies. So just how to kind of get more structure that's working for you in your life. So when I do start working with folks on cognitive therapy, I like to start by showing them this cognitive thinking pyramid. What you see at the bottom are the basic issues and topics that impact everything further up the pyramid. And that's why cognitive therapy involves so much more than just setting up certain organizational systems. I lead my patients in creating an inventory of all of the items at the bottom of the pyramid. So that work involves working with pain management, developing better sleep hygiene, identifying and implementing stress management techniques, checking in on lifestyle factors like nutrition and activity, and then addressing fatigue and even more. So as you can see, those things at the bottom of the pyramid, there's usually something going wrong there, right? So if something's off there, you go up and the energy is going to be off, your processing speed, the attention, memory, new learning, and executive function, which is the highest level of our ability to problem solve and plan and be flexible in our decision making. So it takes a lot for that to be working optimally. And that's why we have to work with all the things that influence it. Okay, so talking about cognitive support. So for adults with ADHD in particular, research shows us that activities need to be perceived as inspiring. They need to include an apparent goal to stimulate performance, and they need facilitating support. So that's where I come in with the facilitating support. And a study from 2021 indicates that the type of facilitating support that can be effective includes these things. So it's like work relating to organizing someone's environment, enhancing social interaction and awareness, developing stress management techniques, and monitoring or regulating sensory integration for the individual. So we'll go through each of these. So the first is improving organizational skills, which I've mentioned a little bit. So some things to consider are breaking down daily activities into steps, manageable steps. I have a lot of patients that have a to-do on their list that's actually 5 steps. So when you approach a task like that, you're much more likely to get overwhelmed and paralyzed and just not do it at all. So breaking down activities and tasks is a very important part of this work. And then also talking about skills that you need to successfully organize your time, and then to address complex tasks and keep up with your schedule. So it's really a matter of finding the structure that works for you, and everyone's different in this way. Another piece that a lot of people might not consider is organizing your environment for success. So what does your space look like around you? If you do work or studying at your desk, is it a space that is productive for you? Is it calming for you? Is it distressing for you? So really kind of bringing in the environment as an important factor in how you work, how you function cognitively. And then moving on to improving social interaction skills. So I think this is important, identifying the why behind your behaviors. Maybe you struggle to socialize at work because you're overstimulated by the environment. So it's just something to consider that does also have an impact on your cognition and your ability to be there with other people. One thing that I like to do with patients is role play social interaction. And while that can feel a little childish, I find it's really helpful to just practice saying the things that are difficult for you, like making your needs known, things like that. And then next is improving time management. So, especially for folks with ADHD, there can be what we call time blindness. And that's when they're not really aware of the passage of time, especially when doing preferred activities. So, I hear a lot from patients that, they played video games or they were crocheting and the time just passed and 2 hours went by, and then suddenly their hands were hurting really bad. And so improving time management is important because you can avoid flares and you can also plan time appropriately to get the things done that you need to. So I talk about like operating in a planned mode rather than a reactive mode. A planned mode, including like developing a planned schedule for the day, and adhering to that schedule, but being mindful that distractions might affect plans. And then understanding when it might be appropriate to exercise some flexibility once a schedule is decided. Rather than in a reactive mode, right, where people might allow distractions to alter adherence to the schedule, might take up activities based on what they're feeling in the moment rather than what they had set out to do for themselves. So this is just something to consider as far as how you relate to your day and how you use your time. And next, we'll talk about addressing executive functioning. So I talked about executive functioning before. It's that highest level of cognition, allows us to do complex problem solving, decision making, planning. And when we come to this area, we want to identify the breakdowns in memory, planning, shifting attention, setting priorities, and controlling impulses. So developing a plan allows us to practice and build confidence with these skills. So it's really about seeing what works. I have many patients where it's just trial and error. We come up with a plan together that feels good, and then they might try it for a week and say, that didn't really work for me, or this part of it did work. Let's keep this and change the other thing. So it's important to know that this is not always a quick fix of like, here's the plan, do it. Yeah, everybody's different, and different ideas and structures work best for different people. So finally, we'll talk about addressing sensory processing. So this is a piece that I put a lot of focus on in my practice. So we want to look for any connections between mood, performance, and sensory stimulation, and then learn to monitor and regulate the amount and type of sensory stimulation you receive. This is a piece that many people don't consider or think about, but we'll get a little bit further into this in a bit. So some cognitive tips and tricks that I like to use with my patients. First is habit pairing. It's a very simple tool that seems to very much work for at least a lot of the people I work with. And all it is pairing a new habit with a task that you do every day. So maybe like you brush your teeth, and then the next habit is doing a meditation, or you take your shower and then you eat a healthy snack. So it's really just utilizing the power of pre-existing habits to link to new ones. And then second is using visual cues. I find that for a lot of my patients, there needs to be a physical sign or a physical list in front of them that they can't ignore. And so I always tell them to tape their to-do list or tape their home exercise program to somewhere like their bathroom mirror, so it's more difficult to ignore. Next, technology. We have so much technology around us, and we can take advantage of it. right? So we can use reminders or a different task management app to create what I call a brain dump list, which is just getting all of your tasks and to-dos out of your brain and into your phone, your iPad, whatever it is, even a piece of paper. And then I like to create another list that's called this week or this week's tasks. And then each week you have a check-in and you take items off of your brain dump list and put it onto the this week list. It seems to be very supportive for people I've worked with, just to let go of having to hold all of the tasks in their head. And then also to make a smaller list that feels more reasonable for that week. Next, we have timers. So another piece of technology that is a beautiful thing. We can use timers to stop doing a preferred activity before we've pushed ourselves too far, like the examples I gave about video games or crocheting. I find this is helpful for patients just to take them out of the time suck that happens when they're doing something they enjoy or they're in sort of a flow state. And then this might be my favorite, celebrate success. Even like you can set small task goals, like I'm going to spend the next 5 minutes cleaning this corner of my desk. And then once you've completed it, you can affirm yourself with a tiny habits celebration blitz, which is just a fun phrase. But yeah, why not celebrate the little successes? Because neurologically speaking, that helps it get wired into our brains better. Like when we actually celebrate and we affirm ourselves, we're sending happy chemicals to our brains, which reinforce the tasks themselves and help keep us accountable for them. And then lastly, there's a phenomenon called body doubling, which is used a lot in the ADHD literature. And it's just having someone there. It's just having someone around that is seeing you be responsible and accountable. So if you're someone who does better with people around, you can invite a friend over to co-work or to be your study buddy, or you can go to a cafe where there are other people working and focusing. And that can make a really big difference for people. All right. So the next piece we'll talk about is the sensory preferences or the sensory processing I mentioned. And we're going to talk about how to harness them to manage autonomic dysfunction, which I know is a big deal with hypermobility. So sensory processing is a complex mechanism, but essentially we actually have 8 sensory systems. Usually we're taught that we have 5. There are 3 more hidden ones that we don't talk about as much. So there are several different types of sensory input and different types of sensory information. We have 8 primary sensory systems, like I said. There's the visual system, which includes the eyes and helps us perceive and interpret light and color. It enables us to see and recognize objects, shapes, and movements. There's the auditory system that includes the ears and helps us perceive and interpret sound. Olfactory system includes the nose, helps us perceive and interpret smells. Gustatory is for taste buds and taste. Tactile system includes the skin, allows us to perceive touch and interpret it. And it also helps us feel different textures, temperatures, and level of pressure applied to our bodies. And then the vestibular system includes our inner ear and helps us perceive and interpret our body's position in space. So it helps with our balance because it knows what position our head is in terms of where it is in space. And so when you have something like vertigo, that's all part of the vestibular system. And then the proprioceptive system, which maybe some of you have heard about, because with EDS, oftentimes there can be an impairment in proprioception. And proprioception is essentially our body's way of knowing where it is in space. We have different receptors in each joint that essentially communicate to our brains where our joint is in space. It tells us how extended or flexed each joint is. But when there's laxity or looseness in the joints, that system can be, doesn't work quite as well. So you can find yourself bumping into things or not knowing where your body is. And that is tied to the proprioceptive system. Lastly, the interoceptive system is a really interesting one to me. It includes receptors in your internal organs and basically helps us perceive and interpret internal bodily systems like hunger, thirst, pain, temperature, and emotions. And this I also find with my EDS clients or patients that this is pretty impaired as well. Maybe they don't know when they're hungry until their stomach is hurting, or maybe they don't know they need to go to the bathroom until it's urgent. So these are important to keep in mind as when we talk about sensory processes or sensory processing. So some people have sensory processing differences in how, or some people have sensory differences in how their brain processes sensory input in any or all of these senses, like we've talked about. And overload can occur when the brain is inundated with too much sensory information. So when a person has differences in how the brain processes the sensory information, it can either be over responsive or under responsive. So sensory over responsivity is marked by a heightened experience of sensory information. And then overload is common for people who are hypersensitive in their sensory systems. On the other hand, experiencing sensory under responsivity means that it takes more signals for the person's brain to register the sensory signal. So these folks tend to be seeking sensory input, like maybe they want to have music on all the time, or maybe they like it when people hug them or squeeze them, or they like to have weight in their lap because they need more input in order to feel what it is. I see a lot of my hypermobile patients sitting with legs crossed in an office chair or in all these different, crisscrossed ways. And that I think is a response to the impaired proprioception. So they're trying to get more input by putting their limbs in a more twisted and more pressed way. So that's just kind of something to consider. And then, yeah, the statistic at the bottom, between 5 and 15% of people have a sensory processing disorder, which is more common in people with ADHD. So this is actually fairly common. All right, now on to tips for managing sensory overload. And you can see here in the graphic, there are some signs of when you might have sensory overload or be experiencing it. So you can feel a wave of fatigue coming over you. You can feel wound up and you end up stimming or doing like repetitive movements. You might have a sense of panic or a desire to escape. You might have an urge to block sensory incoming signals. So that's like you needing earplugs or covering your eyes. You can get very irritable and then restless and uncomfortable. So I imagine some of you might have experienced these things at some point. And so when we talk about managing sensory overload, we want to first identify what your preferences are. We want to talk about what sensory stimuli feel good to you. And then we want to talk about triggers like maybe bright lighting or a loud sound or scratchy textures or a certain texture of food. And then we want to talk about planning ahead, like what kind of environments are we going to be in that day? And do we have any tools that we might need to support us in those environments? Taking breaks is very important. I think in general, we could all take a few more breaks, but with sensory stimulation, really allowing your system to reset and calm down is important in preventing overload. And then implement sensory accommodations. So like I talked about, tools. So some people like to use gadgets. They use like fidget toys, headphones, maybe a soft blanket, maybe a cup of warm tea as ways to regulate themselves when they're starting to feel overwhelmed. And then practicing relaxation techniques. So different strategies like doing mindful breathing or feeling your feet on the ground, getting a little bit of grounding in, things like that can be supportive too. Establishing boundaries is helpful, even practicing ways of saying, I'm overwhelmed, I need to take some space. So practicing how you're going to say that to people around you. And then creating a sensory friendly environment. So in your home, if you have a corner or a room that feels like a calming corner, that maybe has some of the textures you like, it's the temperature you like, the lighting that feels soothing. So trying to create that environment for yourself. And then finally, utilizing a sensory safety plan. So this is what I work with patients on developing. Once we know sensory preferences and triggers, then we can get a better sense of how to create a plan for moments when you get really overwhelmed or overloaded, and maybe you need to escape, or if you can't escape, maybe you can draw from tools that are supportive for you. So this is how we manage sensory processing and sensory overload. All right, so next, we'll talk about navigating the emotional impact of chronic illness. It's a big topic, and it's not an easy thing to take on, especially when it comes to hypermobility. There can be a lot of time and energy spent advocating for yourself and your needs, both in medical spaces and personal spaces, given that it's largely an invisible condition, right? So the energy spent doing this, along with tracking and managing all your different symptoms, can take a significant toll on your mental health. So a study in 2019 showed that 49.4% of a cohort of 391 individuals with EDS or HSD reported being affected by psychiatric disorders. And then 28.9% of the cohort reported multiple psychiatric diagnoses. Anxiety and depression were most commonly reported, with frequencies of 23% and 25% respectively. So this is clearly a problem. I did see in the literature that numbers can vary, but what's not contested is the fact that the percentage of diagnoses like that is higher in the EDS and HSD population than it is in the non-EDS and HSD population. So let's talk about strategies. I just put a few in here. There are many, many, and I like to find ones that fit for patients. But yeah, I do like these 4 that seem pretty simple. So while the sensory processing support strategies tie deeply into managing mental health, these are a few more strategies that have proved helpful for my patients. More than anything, they encourage stepping outside of automatic mental patterns and attempting to connect with our bodies in a more gentle and curious way, which I know can be a big ask for someone who's dealing with chronic health issues. It can be really tempting to separate our minds from our bodies because of the pain or discomfort that we feel. But for more sustainable coping, it is important to try and reframe the relationship with our bodies. And small exercises like this can help one along, can support someone along that journey. And then before I go over these, I do want to note that occupational therapists, while we are considered licensed mental health practitioners, and we share some overlap with psychotherapists and counselors, there are distinguishing factors. And one is that OTs it's not within our scope of practice to help someone process emotional trauma. So while we can support someone with coping strategies and certainly with emotional regulation, it's not as much of a deep dive as a psychotherapist or counselor would do. So I'm always a big advocate of someone being in psychotherapy as well. So let's talk about these strategies. So we have the 3-point check. This feels like a very simple way to insert some mindfulness into the day. So just checking a quick check-in with yourself. What am I thinking? Like, what's going through my mind right now? And then what am I feeling emotionally, but also in your body? Like, what am I feeling right now? And then finally, what am I doing? And this can be a funny experience because sometimes we're just going, we're on autopilot. Let's say we're doing the dishes or we're cleaning up around our house, and we don't even know what we're doing because we're so stuck in our minds. So the question, what am I doing, is like, what's actually happening in reality right now? And I think it's a helpful way to come back to the present moment and just understand that there are multiple experiences going on, and what feels like the most real experience, and can we come back to that? So the next one I'll talk about that a lot of my patients like is progressive muscle relaxation. So this technique I find is more accessible than something like a body scan meditation for folks because it involves active movement. So basically you are going through major muscle groups and you're contracting the muscles, tensing the muscles as you inhale, and then releasing the muscles as you exhale. And I usually start from head and do like face muscle contraction. So make a silly face and then release. And then you go work your way down the big muscle groups in the body until you get to your toes. So that's one technique. And then I'll go to mindful movement and dance. And this is kind of my bread and butter. And so I find that this is supportive, especially for patients who enjoy music, because while the word dance can have a significant association with it, the way I think of dance is really just moving to music. And so what I invite patients to do is just put on a few songs and see what your body wants to do, given how you're tuning into the music, and just kind of inviting in any sort of movement that feels enjoyable. Like you could be playful, it could be put on sad music and see how sadness looks in your body. It's, for me and for many people I know, a way of expressing the emotions that maybe you don't feel like talking about, or there's no other escape for them. So I like to also say that this can be done in any position. Dancing, as per my definition, does not need to be up and about. So you can literally be lying down and do a hand dance or a toe dance. So I like that it can be adapted for people. And then lastly, identifying coping strategies. So a lot of you probably are aware of some of the coping strategies that are supportive for you. Some might not be as aware. I find that explicit information is helpful, especially when you're maybe in a flare-up or you're in a really anxious state and you just want a list to look at and just choose something from your list. So I always encourage patients to have a little list handy of their coping strategies. So that can be supportive at any time. All right, let's dive into handy tools for hypermobile bodies. This is a fun one. So OTs are in some spaces known as the tool or gadget people. And we embrace adaptive tools like these because they offer individuals more independence quickly in their daily activities, and especially when certain functions are constrained by a permanent condition. So if somebody is just not able to regain the strength or dexterity to do something, then why not use a tool? And I also, like I said, if it expedites the process of someone getting to engage in a meaningful activity, then you can be doing the rehab, the strengthening, and the training along the way too. But if you have that sense of purpose because you're engaging in the things you love, it might make that process a little bit more productive. Okay, so principles of assistive devices before we get into the actual tools. So yeah, we try and keep the devices simple. There's no need to get the highest tech thing. There's a lot of great simple tools out there. One of the principles is to extend handles of things. Just having a longer lever arm allows for less force needed to open something or to turn something. And then enlarging circumferences. So it's harder to grasp small things, making them bigger, puts the hand in a more functional position and creates less stress on the joints. And then organize things within easy reach. This might be something you're already aware of, but even just having to reach up to that top cupboard in your kitchen versus having your most used items at shoulder or even waist level can make a big difference as far as joint protection. And then provide support and safety. This is what these tools should be doing, is providing you with support and safety in doing functional tasks. And then, yeah, increase leverage, like I talked about those with those extended handles. Make use of physics. It's difficult, but it's helpful. And then increase independence. These devices, that's their primary objective, right? And then just a caveat, of course, that I'm sure Heather will appreciate. So making sure that activity and exercise is still happening, even if you are using an aid for certain things. So like, even if you're using voice to text on your phone, keep doing some hand strengthening exercises. Yeah, we don't want to be over reliant either on these tools if some rehabilitation is possible. All right, so let's get to the fun tools. All right, so bathroom and cleaning tools, I'll start there. Shower head is very handy, especially one with the bar attached to it like you see there, so you can slide the head up and down. And that would go with, oh, sorry, not a shower chair. This is the shower head. The shower head accompanies the shower chair, because if you're sitting in a shower chair, you're going to need a lower shower head that you can reach and put back while you're doing your washing. And these items, the two together, are really supportive, especially for my patients that have POTS and showers end up flaring their symptoms and they get dizzy. So you might as well sit in the shower so that you don't have to lie on the floor and recover for a half hour after every shower, which a couple of my patients need to do. And then a long-handled sponge or razor. So just putting a longer handle on things allows you to not have to reach quite as far. And especially, again, with those POT symptoms, you don't have to be moving your head up and down, and that would increase the dizziness. And then the hands-free dryer stand, I think, is very fun because it's a lot of effort to blow dry our hair. And if hands or wrists are really bugging us, or if we have a subluxated shoulder, then the last thing we want to do is, blow dry and be all around here. So that's pretty fun. And then a handheld electric scrubber. So one of my patients turned me on to this because cleaning their shower was just an impossible task with their hand pain. And so it's a scrubber brush, and there are some with telescoping handles that allow you to not have to bend over while you clean. So these items are all available just on Amazon, and they're affordable as well. Next, moving on to kitchen tools. So there's this great kit that has the tool in the upper left has a jar, bottle, and can opener. And so it's a great tool just with multiple functions that can help save your hands in the kitchen. And then the right angle knife is a funny and very effective tool that allows your hand to be in a more neutral position rather than here while you're chopping. So it allows you to be in more of like a handshake position. And then built-up handles on utensils. I think in general, built-up handles can be really supportive for people with hand pain because, again, you're in a more functional position. You're not stressing these small joints as much. And then finally, the pan stabilizer, which is, I think, pretty cool. It just keeps your pan in place while you're stirring so that you don't have to be using both hands or dealing with the weight of the pan. All right, and then finally some miscellaneous tools, and this by no means is my full list, but I just wanted to give you a little peek. So first, especially for folks who have POTS, a cane with a foldable seat can be a pretty awesome thing to employ, because if you're out in the community and there's nowhere to sit, which is a lot of places, then you just have a thing to sit on at all times. Especially if you're not wheelchair bound, this is a great mobility option. And then moving over to the pen again. This pen, while it's kind of funny and shaped like a spaceship, is really helpful for folks with EDS because it prevents that hypermobility at your DIP joint in your finger by creating a flat surface for it to rest on. So I've had patients who find this useful. And then below that, we have the compression stocking donor. So putting on compression stockings can be really hard for your hands, your hand joints. And so this device just is like a hand saver. It really helps bring the sock up without having to use your finger joints in that way. Next to that is a key turner, just making the top of the key bigger so that, again, you're not using as much force, right? So making the lever arm longer. So those are some pretty cool tools. Hopefully some resonate with you and you're interested. All right. My next section is about adaptations and accommodations for work and school. So I get these questions a lot because, yeah, work and school is what most people do. And so how can we ask for what we need? What do we have a right to? A lot of those questions come up. So for school, accommodation ideas might include like modifying your schedule, having flexible deadlines, limiting or eliminating busy work tasks. So putting the emphasis more on core classes, and then class breaks as needed. For testing, having extended time, a separate room, calculator, that's more for the cognitive issues. Sensory wise, you can request the use of hats, sunglasses, noise reducing earbuds. And then there's also alternative seating for folks whose bodies don't appreciate sitting in a school chair, which are often very uncomfortable. I don't know why, that's just across the board. And then for writing, the use of a computer or laptop, a transcription aid, and then modified writing utensils, or even having a note taker take notes for you. And then promoting inclusivity in the workplace. I think this is a good thing to talk about in general, and that our society could talk more about. So first is disclosing, right? Disclosing your disability, your diagnosis. And there's a lot of emotions, a lot of like fear that people can experience around this. And it really is someone's decision. And so that is something I like to work with people on. And then knowing your strengths and your boundaries, kind of getting clear on that so that you're able to communicate those more clearly is helpful for everybody involved. Finding a mentor, preferably at your workplace, but if not, somewhere else, who shares a similar condition or experiences a chronic condition. And then, like I said, with your strengths and boundaries, asking for what you need, which is not easy for a lot of people, but really learning how to advocate for yourself. Finding the right workplace. Not every workplace is so friendly to folks who need accommodations. So making sure that you screen the workplaces. And then mobilizing support, really getting buy-in from your team and having them know what your needs are. So changing the system from within. If you find yourself in a workplace that is not that friendly to people with disabilities, with accommodations, how can you do something about it? Do you have the energy and effort in you to try and make some of that systemic change yourself? And that kind of ties into advocating, right? Is knowing when to advocate and how. And then strategizing about securing accommodations. And even more importantly, knowing your resources and your rights. AskJan.org, or Jan is Job Accommodations Network, is a really great resource. It lists specific recommended accommodations for all sorts of diagnoses, and there is a page on EDS there, and that's pretty handy. So I would write that down. And then for financial aid opportunities for students with disabilities, you can go to onlineschools.org. That's a handy tip as well. Okay, so finally, navigating education and work. Communication, like we talked about, disclosing what that looks like, and then practicing self-advocacy. Do you want to be, with your communication, do you want to be direct? Do you want to be assertive, open, for self-advocating? Like, how well do you understand and communicate your condition? Are you clear on your actual needs? Do you have solutions prepared for them? Maybe have you rehearsed that request conversation? And are you organized with all the resources that you need, the doctor's notes, things like that? And then pacing. So pacing, OTs love to talk about pacing because it's such an important part of living with chronic illness in particular. So even in education and work, it's the same, just taking the breaks that you need, resting before you overdo it, planning and giving yourself enough time, and asking for help. And then energy conservation. So using the assistive devices and the technology that we talked about, and then ergonomics. So when you use your body, you do it wisely. That's kind of what ergonomics means. And then knowing what good body mechanics are too. I'm kind of a nerd about workplace ergonomics because I think we spend so much time in a certain position or in certain positions, and having the knowledge of what positions are healthier for our bodies can be very empowering and make a significant difference in our health. So I talk a lot about desk ergonomics because a lot of my patients work at desks or study at desks. And so these are just a few points as far as how you might set your desk up. And you really do want to raise your monitor up to your eye level so that your neck is not tilting down. It has a very significant impact on your neck and your spine in general, even just that little bit of tilt for an extended amount of time. And then, yeah, the monitor should be an arm's length away. If you raise your monitor, then you do need an external keyboard and mouse. Trackpads are unfortunately not very hand-friendly things. It just doesn't put the hand in a very functional position, and it forces use of the smaller hand joints. And then your elbows, wrists, and arms. So adequate places to rest your forearms, especially for folks with EDS, because it helps support your shoulder, right? Being in the right place, really having that support under your arms. And then elbows should be at your sides, wrists in neutral. And the chair is an important piece too, making sure that you have the right back support, making sure that your feet are touching the ground, unless you like to be in the cross-legged position. And I won't take that away from you because I know that feels better. So it's really about what works for you, what feels good. And I try and incorporate that when I work with patients. All right, so the last section before we get to our activity is facing chronic pain and fatigue. So pain and fatigue are like the elephants in the room that maybe nobody sees but you, because of sort of the invisible nature of this illness. It can be really isolating and disheartening. So it's no wonder that there's so much involved, right? And people are constantly facing the pain and fatigue. So we'll talk about first energy conservation. So the 4 P's of energy conservation include plan, pace, prioritize, and position. So planning is like avoiding extra trips, thinking about what you need to do with your activity before you start, gathering what you need, planning to do the most difficult activity when you have the most energy. So really kind of creating a plan for yourself around energy levels. And then pace. So do an activity that's difficult and then maybe one that's easy, alternate. Take your time, allow time to relax, things like that. Prioritizing, that's kind of going to planning, choosing the most important things to do first and get them done. And then ask for help when needed. I think that's very important. And letting go of unnecessary tasks. And lastly, positioning. So keeping things that you use in places that are easy to reach, like I was talking about, let's say in the kitchen, keeping items that you use at waist level or shoulder level. And then sit or stand as straight as you can. That promotes easier breathing. And it's just better to be in alignment with your skeleton. And then sitting in chairs that fit you and have armrests that can help you get in and out of the chair and support the weight of your arms. Avoiding the boom and bust cycle. I'm sure this is a familiar concept to many of you. So it's like, oh, today's a great body day. I feel like I can get a lot done. I should take advantage of the day. I'm going to take on all these things that are hanging over my head. And then that night, pain and exhaustion. Next day, inability to function, basically. And then I shouldn't have done any of those things. I can't do anything. So this is a pretty common cycle that happens with chronic pain and illness. And I like to use a strategy called the traffic light system. So you divide up activities into 3 categories depending on the level of energy they take. So green is for easier tasks like answering some emails or making cereal. And then orange are tasks that take a little bit more energy, like preparing a very simple meal or taking a shower. And then finally, red tasks take a lot of energy. So that's like going for like walking your dog, attending a medical appointment. And so for every person, these colors are going to be different depending on what tasks are more taxing for you. But the most important thing to keep in mind is there should really only be one red task a day if you can manage it. If you find that you have a day with 2 or more red tasks planned, just try and look at the day and plan, right? See what's possible, if it's possible to reschedule something or just plan in breaks. All right, so and we're going to talk about chronic pain. So the biopsychosocial nature of chronic pain. Pain is, yes, a biopsychosocial phenomenon. And that means that not only is it affected by our biology, but it's affected by our activity level, sleep, nutrition, mood, thought patterns, medications, and social connections. So there's a lot that goes into it. And I think knowing that, at least for me, is empowering because it means that I have a little bit more say and a little bit more control. So managing flare-ups, and this will lead us nicely into our activity. First is choosing curiosity over blame. It can be pretty easy to blame ourselves when we end up in a flare-up, but the fact is that it's not helpful to our psyche to be blaming ourselves. So rather than landing in that space, to try and be curious and see if you can kind of see for yourself what led to this, what steps can I take to avoid it in the future. And then secondly is be with yourself. So it's like creating a space to really be with yourself, because flares are an invitation to slow down and listen to your body. So the first step in that might be identifying what helps you feel safe enough when you're in a flare up to relax and tune in. And then the next step, tuning into your emotional experience. So our emotions are very interwoven with our pain perception and experience. So focusing on and tending to the emotions that are beneath the pain experience can be really powerful, especially in a flare. And then at the bottom, there's a simple practice that's been referred to as the RAIN practice. And you essentially go R, recognize the emotion present. A, allow the emotions to be there. I, investigate your emotional experience from a more body-based lens rather than an intellectual lens. So you're asking yourself, where do I feel this emotion in my body? What physical sensations am I feeling? Does it have a color, a texture, if you're tuning into it? Is it moving or staying still? So just trying to get a better sense of what's happening inside. And then finally, N is for nurture yourself, calling on your higher self to care for what's happening. And then also calling on outside supports too. So we are to our activity portion. So let me see, I will chat a link to everybody. All right, so we have a few options. You can go to this link and you can go to file and make a copy so that you can make your own copy and write in it. This copy is not editable right now. Or you could do file and download and just type in the Word doc on your computer. Or you can just look at the questions on this next slide and write your answers on a piece of paper. So maybe I'll give folks just a minute to do one of those 3 actions.
Emily, while you're pausing, I didn't know if you had a link. Someone asked for the grippy twisty thing that could open up jars and lids. If you have a name of it or a link for that, that would be awesome.
Oh boy, do I. I definitely do. I'll send it right now. Let's see. Did that take my presentation off? There we go. All right. Hopefully people are settled and have their whatever way of taking notes. All right. So the activity is to create a flare-up action plan. And we're doing this because proactive management during flare-ups is really important for mitigating or even preventing future ones. So I thought we'd take a few minutes to answer some of these questions, and then if you all want to share some of your responses, that would be great. I think we all might have some tools that could be helpful to hear and share with one another. So why don't we start by doing the symptom management supports and the activity modifications, and then we can take a pause and share and move on to the next section after that. So that first prompt is, what medications, supplements, or other tools help to ease your symptoms and help your body find more comfort? So we're focusing on medications, supplements, or other tools. And I'll give us maybe, let's see, we'll answer that question and then the following one as well. So the activity modifications that reduce energy needs or symptoms. So that's the, how can you modify cleaning, self-care, leisure, other daily living activities? And then how can you improve your sleep? So maybe we'll take, let's see, it's 8:04. We'll go until 8:06 for these questions.
Anyone has a cool idea or a hack that you feel like you figured out, if you want to put that in the chat to share, that would be awesome too.
I'm loving these ideas coming in the chat. All right. So does anyone want to share one of your answers or one of the things that comes to mind for you? I know I'm seeing some things in the chat. I don't know if anybody wants to unmute and share anything. Doesn't have to be magnificent, just something simple. Elizabeth, those glasses are very cool. I've seen those. They have like mirrors in them, right? So that they can orient. You can lie on your back and be on the computer. It's pretty cool. And I'd never heard of bongos. That's cool.
I think the bongos you might have to get at a sleep doctor's office, but there's a new one that I just heard about. You can get online called OptiPillow.
Okay.
That I'm gonna try, so I can report back later. That in the chat. I think it's called OptiPillow. Let me double check. I got the name right.
Exciting. And then, yeah, I've definitely heard some folks benefit from pregnancy pillows as well. So that makes sense, Jessica. And I love that. I'm going to definitely join the EDS life hacks group. That sounds like a great resource. All right, so if we want to move into the next few prompts, we can do, let's go with just the emotional and mental health supports. So first is favorite ways to distract yourself, which is a very effective coping strategy. And then helpful ways to express your emotions during a flare. So that could be like journaling, drawing, playing music, dancing. Supportive relaxation tools. So there's a link to a guided meditation there if you're interested in the Google Doc. And then finally, reflections and affirmations, my favorite. What do you notice about your thoughts during a flare? And what other statements can you tell yourself during this time? So it's 8:09, maybe we'll go until 8:12. And you can also just keep typing things in the chat as they come up. Thanks. All right. Anybody want to share about the emotional and mental health support prompts? You can either unmute or you can chat. So I'll say for reflections and affirmations, definitely thoughts during a flare are um, how did this happen again? Or like how am I back here again? Just sort of resisting the reality of it. And then other statements I could tell myself is my body is telling me I need to pause, or I'm going to take this time to reflect and try and see what learning is available for me at this time. All right, and then so next section is social supports. So who can you rely on during a flare up? What are some of the ways that people can best support me? I think this is a particularly helpful question because often folks in our lives don't know how to support us when we're in a flare up because maybe they don't understand it as well. They just aren't very well versed in what we're going through. And so really having a clear understanding of what requests to make of someone or how to express what would be helpful can improve the relationship and allow for more relevant support during flare-up times. So maybe we'll take a minute to answer that one. Yeah, and Eondis, sorry if I'm not saying that properly. I really appreciate that. The supportive relaxation tools. Yeah, chakra visualizations. So going through different points in your body, really sending your energy to various places. Loving kindness, definitely. I would also add in there some self-compassion meditations because that well can run dry, especially during a flare-up. So inviting in a little bit more compassion for ourselves and what we're experiencing and what we're experiencing. All right, so next is moving on to movement. So during a flare, it can be very tempting to just not move at all. But research shows us and experience tells us that gentle movement or stretching can be helpful. Just getting a little bit of blood flow, getting some motion in your joints can be really great for mitigating pain and calming your pain system down. So spend a minute thinking about what kinds of movement feel supportive to you, even during a flare time, and maybe pop those in the chat. Heather, I love that idea. That's very cool. Right. Got someone who said myofascial release with balls. That's great. That's definitely some movement and also some good input into our muscle belly that can be supportive. And I mean, myofascial release, especially if you're using a foam roller or you're up against the wall with a ball, there's definitely movement involved in that. So that's great. All right, final question. So navigating flare-ups and increased pain isn't easy. We know this. And it gives us an opportunity to check in with ourselves, right? How can you meet yourself in difficult times with more curiosity and care? What's one thing you will do during your next flare to feel more empowered? And that can be either mentally or physically, though they are often tied. Imagine that. So yeah, just identify one thing, at least one thing that you'll do during the next flare up time. Hopefully there won't be one, but I can imagine for many of us there will be. So what can you do during that time? All right, anybody want to share the one thing that they might do during the next flare up? And then we'll wrap up. All right, so if nobody has anything, I'll move on. So I'm just at my final slide. So thank you so much for having me, for being here, for listening, and hopefully you've learned something that you can take with you and bring into your daily life.